You're listening to Health Innovators, a podcast and video show about the leaders, influencers, and early adopters who are shaping the future of healthcare. I'm your host, Dr. Roxy Mooney. Welcome back to the show, Health Innovators. On today's episode, I'm sitting down with João Bocas, who is the CEO of Digital Salutum and the #1 digital health influencer. Welcome to the show.
Hi, Roxy. Thank you so much for having me. Delighted to be here.
So tell our audience a little bit about your background and what you've been up to these days.
Yeah, sure. So I'm a Portuguese national. I moved to UK in 2001, nearly 21 years ago. I have two passions, really, sport and health. And I'm very privileged to work in health. And I've been involved in many things. My primary industry was professional sport many years ago, and then I transitioned to health, and then I was in corporate wellness for a number of years. But the last 15 years I've been working in healthcare, and the last 7 very focused on digital health innovation with technology and wearables. I have a strong focus on that. So things really evolved, and now I'm working globally, really.
So when you think about the work that you're doing in Europe or in other places around the country versus the US, how would you kind of divide those percentages?
Yeah, I would say half of my following, Roxy, because of the internet, is actually US. Mm-hmm. And yeah, so I'm based in UK, but I have a very strong following in US. Also have some clients in US. And then Central Europe primarily. I also have very good connections in Middle East and Asia, but I don't have a strong presence, to be honest. Sure. But I would say probably 50-50 Central Europe and US, really.
Okay. So when you think about the wearable market, how is it different? So for someone like yourself that's involved in, on a global scale, what are some of the different trends in wearables in the US market versus what's happening in other places?
Well, very good question. I've done a lot of research around wearables, and the European market is, the uptake is kind of strong, about 20-25% of the adult population as a wearable or intended to have one within the next 6 months. I don't have a lot of data in wearables in US market in terms of the consumer adoption, but I believe to be very, very close. But my impression is that the US is slightly behind Europe in the adoption, even though the market is much, much bigger in terms of numbers and shipments of the large brands. But that's my impression. But the wearables market is very vibrant right now, because you have the wellness side, and also the wearables now starting to play a very crucial role in healthcare on a medical side. So, and they are used for research and pharma, and getting human vital signs and biometric data. So the wearables market is actually very, very exciting right now.
So let's talk about that. Like, what are wearables? Just to give a little bit of baseline understanding, because, some people in the audience might know exactly what you're talking about, and we might all interpret it in different ways, right? When we think about wearables, we often think about Fitbits, we think about smartwatches, but there's a lot more to it. So how would you define what is a wearable and some of these other tools that are happening in the marketplace?
Yeah, sure. My understanding is that a wearable is like anything that involves a piece of technology attached to it. Now, and you mentioned really well about the association with smartwatches and the fitness trackers, because they're the more traditional, the wristbands. I'm actually, Roxy, from the times that, I have an Oura Ring and I have another Oura, and my office table is full of wearables, to be honest with you. Yeah.
Wearable playground, right?
Kind of. We associate with the wristbands and the Apple Watches. I'm actually from the times a long time ago, from the pedometers. That was just a single digit, or maybe 20 years ago, and was a very revolutionary, like, oh, let me see how many steps I have on my counter. But now also wearables are coming in many shapes and forms. I mean, smart rings, They can, I mean, smart belts, smart shoes, and also a very hot topic and trend is smart clothing, because the sensors now and the capability of wearables, the technology really can more or less go anywhere you can think of. Even some very well known smart glasses manufacturers now, they having like technology embedded, which we can consider also wearable, because the hearables now also like um, anything you can imagine is like a wearable really.
So would you say that remote patient monitoring is also tied to wearables?
Yeah, also in terms of medical devices, yeah, wearables now are used very much to keep one eye on, let's say, patients' well-being and vital signs. Is a clear push in the industry to go towards that direction, because then you can actually monitor people remotely at home or care homes, wherever they are. And that is very powerful, because the wearables are actually gathering data and transmitting that data into the professionals or to the carers or to someone that has a relevant interest in that. So wearables are, yeah, very crucial right now.
It's funny because I think of wearables as, often a very sexy buzzword, just like innovation or digital health or AI, right? We kind of throw these terms along. But let's kind of just drill down into a little bit more of the adoption. What is the comparison between the sexy talk of these buzzwords like wearables and innovation versus actually adoption, and maybe what that gap might look like?
Well, very good, very good question. In terms of the healthcare industry as such, I think we are actually at the very early stage. In terms of more the fitness and wellness industry is kind of very developed. If you see, for example, the Apple Watch is on its sixth version and now it's got like atrial fibrillation, and they are really a medical device now, but they position themselves not as a medical device because they don't want to conflict with the medical sector and with, because to do that, I mean, one of the things that they should have considered is to have a service attached to that, because then they could, for example, offer the capability of the device, but then also the technical support and the human side of things. Because now, okay, I get my heart rate or my alert on my watch and so on. If I'm on my own, on a mountain, on an holiday, on my bike or whatever that is. But wearables now, you see, they are evolving very fast, and they are extremely intelligent, and the capabilities are very advanced. You see, Apple, I mentioned Apple, I don't want to mention other brands, but they're always progressing to the next thing. Now, for example, the smart ring or a ring on the third generation, they got 24/7 heart monitoring capabilities. So they're very advanced because technology is moving really fast.
Mm-hmm. Yeah, definitely. And speaking of moving fast, so from your perspective, how has the pandemic been a catalyst for wearable adoption or just digital health adoption in general?
Well, I think it's a blessing in disguise. I know a lot of people died around the world, unfortunately, but for digital health, I talked to a lot of stakeholders with regards to telehealth, telemedicine. We were pushed to do things differently, digital, virtually, and in that regard, it pushed the industry forward, forced us to behave in a different way. You couldn't access clinics and hospitals and even doctors, so we have to do everything online. With regards to wearables, I've also seen a trend of people now, they're really concerned about their health. They were before the pandemic, but the pandemic really just has risen this awareness that our most precious assets, the health is wealth. And we've seen that we started to get concerned about our own health, about our families' well-being. And wearables are actually they're not the magic thing to make you wealthy, but they are a very good partner if you use a wearable in a nice way to gather your diet and monitor, also engage in some healthy behaviors. Now wearables have very sophisticated capabilities about telling you reminders and alerts about notifications. You should be moving, you should be stretching your legs. Sometimes, I mean, on my Aura Ring app, it's very peculiar. If you stand, for example, in a chair working for 2-3 hours, it gives you an alert saying you should be stretching your legs, which is like, well, who would think that, 10 years ago? So
Yeah. I mean, you think about all the wearables with the data that's being collected, it kind of brings to light this quantified self. And when we have this heightened awareness about this, the performance of our bodies or performance of our health, I think that it does, can trigger a change in behavior with this, and being more empowered with this new knowledge that we have.
yeah, absolutely. What I've done many keynotes around the world around wearables, but I always remember this one I've done in London about the first one, and I repeat this often. The wearables are not the miracle. The human being is the most important element in here, but the wearables used as a supporting clever partner. They can be very powerful because you can compare even data from a month ago and say, actually, I lost a bit of weight, my heart is getting a bit fitter. You have all these things to establish comparisons with data. You can get your sleep tracking in nowadays. You can say, actually, last night I only slept 5 hours, but I've been sleeping an average of 7 hours a night. So you can actually do lots of different things. But what I like about wearables is I think everyone should think about engaging with wearables, how they feel more comfortable, but pick one thing they want to make a change to start with. I'm a fan of fashion. I like clothes, I like watches, but now is this very big trend about fashion tech. Yeah, nice wearable, they look good, they have different colors, different shapes, which is fantastic. Different, you can go with your clothing. But what really sustains the long-term engagement is your interest in a particular thing. For me, for example, a few years ago was the steps. And then I started doing triathlons in my 40s. It was the performance with my running and my cycling. Now I'm interested in my data. I'm getting older, my interests are changing. I'm interested in my sleep data. So, because, as everybody knows, sleeping is correlated with your performance, overall well-being, and also optimal function. So, but what is important is for each of us are different. Yeah, you might be interested, for example, in losing weight. That's not my first priority, but we should engage with one thing that intrinsically gives us the motivation to kind of keep going.
Hey, it's Dr. Roxy here with a quick break from the conversation. Are you trying to figure out what moves you need to make to survive and thrive in the new COVID economy? I want every health innovator to find their most viable and profitable pivot strategy, which is why I created the COVID Proof Your Business Pivot Kit. The Pivot Kit is a step-by-step framework that helps you find your best pivot strategy. It walks you through 6 categories you need to examine for a 360-degree view of your business. I call them the 6 critical pivot lenses. As you make your way through this comprehensive kit, you'll be armed with the tools, tips, and strategies you need to make sure you can pivot with speed without missing out on critical details and opportunities. Learn more at legacy-dna.com/kit.
So let's talk about healthcare and the place of wearables in healthcare, right? As you're talking about, fashion tech and consumer trends and tracking sleep. And so you kind of have like this convergence of the wellness side with the healthcare side. But I'm curious from your perspective, like what's really happening in healthcare? Are payers starting to pay for services around wearables? Are providers starting to prescribe some of this wearable tech to help help with patients' care journeys? Or do we see more of this being driven by consumers and less about the healthcare industry itself and, having to play catch up to where consumers are?
Very good points there. I think the healthcare industry as a whole, and I'm heavily active in that regard, is not really taking the advantage of the wearable capabilities and the potential yet. I think we are at very early stages. I think it's more driven by the consumers still, even though there are payers and insurers starting to move the needle, if you like. And I'll give you an example. In here in UK is a very well-known insurer that has a wellness program that they reward the insurees with points and discounts if you display healthy behaviors. You go to the gym, get some points. You use an app, get some points. You use a wearable, get some points. And that starts to be a trend. I'm actually surprised not many other insurers are following this model, and many other payers are not on board on rewarding people for good behavior. Good behavior means healthy behavior. Healthy behavior means there will be a direct benefit for them in cost, clear return on investment. So, but we're moving in that direction. It's just a matter of time. But I think the market is now ready for us to really make this transition and see everybody like moving in that direction. And the competition is actually the market itself will ask everybody to move in the same direction.
Yeah.
Somewhat.
So what are some of the obstacles and barriers for healthcare to take more advantage of these tools out there, like you've just described?
There are many. I've done a 159 pages report on health wearable engagement, seriously, and we found lots of stuff. We interview people about how to use your wearable face to face. From the user perspective, I'll give you a few insights. From the user perspective, we see the lack of motivation, sometimes very small and unbelievable barriers like, I forgot to charge my wearable. Okay, that's the basics. If you don't charge it, no battery, no data, no benefit. The lack of support, the lack of education, teaching people. I know all the wearables come with a guarantee and the user guide, but also educate people about health and educate them how to make the most out of your wearable. I think that is still missing. But then from the, let's say, the device related barriers, in this case, to answer your question about the industry, interoperability is still a very big barrier, communicating with other systems, getting the data, getting reliable data, because the wearables present actually a very big challenge in terms of discrepancy with the data and the accuracy of the data. If you use Apple Watch and a Fitbit, they will give you different readings, which might vary from 8 to 10%. And I'll give you an example. If you wake up in the morning and check your wearable right away, you have, for example, 200 steps, but you only come out of bed, you only done maybe 2 steps. Yeah. So because they function by accelerometers and the sensors, so the data is not totally accurate, which presents a very difficult challenge for healthcare. Because if you talk about general wellness, okay, if I don't have 8,000 steps, if I have 8,500, who cares? But we're talking about the medical side of things, heart rate and vital signs. And if we consider, for example, a very particular condition, an important condition, we can't really have very unreliable data. So the wearables have that the reliability is extremely important. Then there are ethical issues, suspicious of, for example, sharing data for good purposes. Most people agree with that, but then what happens if my data is just on web, or is shared with insurer, or is shared with pharma companies? Is all these like
Absolutely.
yeah.
What if
So
I gorge on some Oreos tonight
yeah,
and then somebody knows about it and
yeah,
my health insurance premiums go up?
yeah,
I
yes.
mean, it's a
Nobody
little bit of
wants
an
that.
exaggerated example, but yeah. Mhm.
So it's lots of things to consider. There are some barriers in the healthcare system because the wearables are not. I think they will, but they're not fully integrated in, let's say, the patient flow and the healthcare model as yet. Because there's
Yeah.
also the barrier of the price, who pays for it. The wearables are not, even though the prices are going down, they're not very affordable to start with. So it's a couple of hundred, and there's always this question. I would love to turn the model upside down and give the reward and try to save later on, but it's always this initial cost up front, which still represents a barrier because in the ideal world, everybody should have a wearable and do something with it, So
Yeah. So as a wearables expert and advocate around digital health, what are you doing to help break some of those barriers?
yeah, I'm sharing a lot of content and I'm starting these conversations with stakeholders. I'm working with a few very large tech brands at the moment. Also, I started this a podcast similar to yours around. It's called Digital Health and Wearable Series. I interview global leaders around the world to talk about lots of different challenges in healthcare. So yeah, and I was doing lots of keynotes around the world around wearables pre-COVID. I've done lots of virtual, and I'm starting to travel again. I was actually in Portugal last week, deliver a keynote for a very large pharmaceutical company, because the wearables now are part of the conversation, because they cannot be left out any longer, because they important, they play a crucial role.
So I think that you probably can appreciate this as a speaker, as a podcast host. You are most often then interviewing other people and giving them an opportunity to share their expertise and their stories. But I want to kind of ask you, since you're a guest here, our community is all focused on healthcare innovation, and from all different sectors, payers, providers, pharma, the innovators themselves, the startups, as well as some of the more mature health plans and hospital systems. So very broad context. But what do we all need to know about wearables that maybe we don't already know?
Very good question. We need to know a couple of things. One, that they're moving in terms of even innovation extremely fast. We've seen these new versions of the Apple Watch, the Oura Ring. Also, we need to know that for different purposes, we need different wearables, and obviously certified and ratified, and sometimes, and this is my personal opinion, the wearables are great, but they also gather a lot of different data sets that sometimes are unnecessary for a certain purpose. For example, if you want to work on a cardiovascular disease or particular research, you might need just 2 or 3 sets of data, but the wearables bring more data, and that can be actually an advantage in certain cases, but is a big disadvantage because it's more data to deal with, unnecessary data, and also the data is not translated in information, which is one of the big challenges. And a few years ago, we had a lot of AI capabilities, artificial intelligence. We didn't have data. Now it's starting to be the other way around. We have too much data. And now the AI is starting to get really a really great use. I've done a piece of a chapter for a book. And the chapter was, in my opinion, the combination of wearables and artificial intelligence will be the game changer in healthcare. And I think that is a very, very great combination and much necessary, because what are we going to do with all this data? And then there are other things about, and I'm not a technical expert, but there are other things about making sure the integration is done properly. The the wearables reliability is extremely important. So work with reliable brands. Really, I tested a lot of wearables, Roxy, from India people and from China. People send me a lot of stuff, and I don't want to criticize anybody. Everybody's trying to do their best, but there are a lot of unreliable wearables that I would never use for any purpose, because
Sure.
because you can have a wearable now, and I see these in the shops now. You can have stuff from China for like $10 or $20, but then they don't work. Seriously, now it's so much counterfeits and yeah. So anyway, just be aware of that, because you can go on internet and such. It looks like the same, the Apple Watch, and it's like a wearable for $20, and of course it's not right.
Just telling me what I want to hear.
Yeah. So be aware of that. I mean, even the consumers, but it's so much choice on offer. But I know from the healthcare industry, which that we're talking about in here, but then also represents the challenge of the price, because a good wearable or good medical device, but the cost is coming down, and there are many innovators, such for example, AliveCore, that bring the cost of innovation really down. So I think it's great news for healthcare.
Sure. Yep. So I want to wrap up here with one question around your legacy. I believe really strongly that a lot of the work that we're doing is shaping the legacy that we're leaving behind. And I think it's such an altruistic initiative to try to have a mission in healthcare and really transform and change the world of health. So when you think about how do you want to be remembered and what kind of legacy you want to leave in healthcare and maybe outside of healthcare, share that with us. How do you want to be remembered?
Roxy, I never really thought about this, to be honest. And I have my own vision. I can say that I envision that the wearables can change the world. And I'm talking particularly in healthcare, but even other industries. But I have a particular vision for healthcare, and I'm working towards that, to make healthcare uncomplicated, to transcend the barriers to human health. We need to do a bit more, and all of us in the industry need to educate the patients, need to break these barriers of adoption, need to make the technology more easy to use. There are lots of different things, and one thing that recently is come up is health equity. I mean, we should all be on the same page. So, but I would like to be remembered. I would like to make a greater impact in the world, and I would like to do make an impact, a stamp on healthcare, and maybe even beyond.
That's beautiful. Isn't that what it's all about? Changing the world, leaving our mark on the world, leaving it a better place. Well, thank you so much for joining me today. How do folks get a hold of you if they want to follow up with you after the show?
You can easily find me on social media. I'm very active, particularly on Twitter and LinkedIn. On Twitter, the hashtag is @wearablesexpert. On LinkedIn, just search my name, João Bocas, you will find me.
Awesome.
Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and attention. To get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who shared the show with friends and colleagues. See you on the next episode of Health Innovators.